It's been a couple weeks since you did the deed, and now you're dying to know, am I pregnant? You'll need a home pregnancy test or a blood test at your OB's office to know for sure, but until you can take one, the best time is once your period is late. Click through these early signs of pregnancy and see if any of them feel familiar. Shortness of breath. Do you get winded going up the stairs all of a sudden? It might be because you're pregnant. The growing fetus needs oxygen, leaving you a little short. Sorry to say, this one may continue throughout your pregnancy, especially as your growing baby starts to put pressure on your lungs and diaphragm. Sore breasts. Putting on your bra this morning felt like mild torture. And are you imagining it, or are the girls a little bigger? Tender and heavy feeling breasts, darkening of the areolas and even more pronounced veins on your chest can be a first sign that you're pregnant. Wear your most supportive bra to bed if you need it, to help ease discomfort. Fatigue. You didn't even make it through one page of your book last night before falling asleep. If you're suddenly exhausted, it might be a response to the increasing hormones in your body. For many women, tiredness continues through the first trimester, but then ebbs in the second. Nausea. Most pregnant women start to get the queasies when they're about 6 weeks along, but some can experience morning sickness, which unfortunately can occur morning, noon and night, earlier. It will most likely subside as you enter the second trimester. In the meantime, try to eat foods that will settle your stomach, like crackers or ginger ale. Frequent urination. If you suddenly find yourself unable to sleep through the night without a trip to the loo, it might be a sign. During pregnancy your body produces extra fluids, which has your bladder working overtime and you taking a lot of pee breaks. Headaches. More early signs of pregnancy include an aching head, a result of changes in hormones. Just in case you are indeed pregnant, take PG-safe acetaminophen instead of ibuprofen to deal with the pain. Backaches. Is your lower back a little sore? If you don't normally have back pain, it could mean your ligaments are loosening. Sorry, this one might continue through your pregnancy as your weight gain and shifting center of gravity throw your posture out of whack. Cravings or food aversions. Suddenly, you cannot get enough citrus. Or perhaps fish now turns your stomach. If you notice food issues that weren't there before, it could be your body telling you you're pregnant. Constipation and bloating. You swear you fit in your skinny jeans just last week. If you're feeling a little puffy or backed up, it might be extra progesterone due to pregnancy, which slows down your digestive system. Mood swings. World War III erupted over your husband's failure to put his socks in the hamper. Moody much? If you're feeling a little hormonal, it might be because your body is adjusting to, new hormones. Assure your husband that the roller coaster emotions will pass. Elevated basal body temperature. If you've actively been trying to get pregnant, you may have been charting your basal body temp to pinpoint ovulation. Generally, your BBT is elevated from ovulation until you get your period 2 weeks later. If it stays elevated beyond 2 weeks, it might be because you're pregnant. Super smell. Your garbage can now make you gag guess you're off trash duty. If you're repulsed by certain smells, or have an increased sensitivity to odors, it may mean you've got a bun in the oven. Dizziness or fainting. This is the go-to symptom they use to signify pregnancy in movies, but it's based in reality. Low blood sugar or blood pressure can cause a woozy episode. Make sure you eat enough and stay well hydrated. Spotting. Darn. You got your period. Or did you? If it was much lighter than normal, and a few days earlier than expected, you may actually be experiencing implantation bleeding, where the fertilized egg attaches to the uterine wall and causes a little bloodshed. Late period. Many of the early signs of pregnancy are also symptoms of PMS. How to tell the difference? The most telling clue yet will be a missed period. If your cycle is fairly regular and you're late, you should head to the drugstore. Positive pregnancy test. You won't know for sure whether you're a mama-to-be until you do the P-stick test. If you get a negative result and you still don't get your period, it might just be too early for the test to detect. In the meantime, look a few of these weird pregnancy symptoms that can appear upon conception. Wait a few days and try the test again. And if it's positive, congratulations. Positive pregnancy test. You won't know for sure whether you're a mama-to-be until you do the P-stick test. If you get a negative result and you still don't get your period, it might just be too early for the test to detect. In the meantime, look a few of these weird pregnancy symptoms that can appear upon conception. Wait a few days and try the test again. And if it's positive, congratulations. Do a home pregnancy test. First, you want to know for sure if you're pregnant, and the best way is by doing a pregnancy test. Just visit your GP or buy a kit from your local chemist. You can do a test from the first day of your missed period. It takes 2 weeks from when you conceive for the pregnancy hormone, human chorionic gonadotrophin, HCG, to show in your urine, so try not to test too early. It's possible that your first test might be a negative, but if you're displaying the common early signs of pregnancy and your period hasn't arrived, you should retest a few days later to confirm. Still having periods. It is surprisingly common to have breakthrough bleeding or implantation bleeding during the first few months of pregnancy. It's thought this could be due to the egg implanting in your uterus or the hormones that regulate your period being higher. It even means some people don't realize they're pregnant for a while. Always, get it checked out though, to make sure there isn't a problem. See your doctor if you're displaying the early signs of pregnancy. The first thing you need to do is see your doctor or local midwife, who can get you registered with the maternity services in your local area. They are a great source of information and support if you're ever unsure of anything during your pregnancy. Mixed emotions are normal. Finding out you're pregnant is huge. You might feel wildly excited one minute and terrified the next, and your partner might be on a roller coaster, too. Not only are you processing major news, but your body is changing fast and dealing with a riot of new hormones. So if you're feeling a bit all over the shop, it's perfectly normal. Keep taking folic acid. Taking folic acid during pregnancy helps lower your unborn baby's risk of spina bifida and other neural tube defects. The Department of Health recommends you take a daily 400 micrograms, mcg, supplement 3 months before conception, ideally, and up to the first 12 weeks of pregnancy.